with her own child, moved in, kicked Mrs. W out of her own bedroom, made her sleep on a horrible couch that didn't even open up, used her cards to charge more than $30,000, didn't give Mrs. W anything that Mrs. W needed for her very severe diabetes. And she was very distraught, but she only called and asked for the meal. A meals-only client, we're told again and again, really doesn't need much. With the help of our agency and a partner agency and the DA, we then got her into the hospital, which she needed, and then into assisted living. So now she is safe and she's being taken care of. But it took the job of a trained social worker to recognize that she was being abused and to do the job that needed to be done to get her out of her home and get her safe. Thank you.
I want to now introduce Councilwoman Jessica Lappin, who's the chair of the Aging Committee and is a terrific advocate for seniors.
Well, thank you all for being here today. The cuts that are on the table are brutal and heartless, and we are here to fight them because the invisible, frail, homebound elderly cannot come to the steps of City Hall and fight for themselves in freezing temperatures. So we are here to speak up for them. I think we've all heard the expression that 1 ounce of prevention is worth a pound of cure, and I think nowhere is that more true than when it comes to case management. It is the intake valve for all services, for a meal, for transportation, for home care, and really what that means is that for some people, the difference is a hot meal or being out on the street. The difference is some help in the home or being in a nursing home. And if they can't be evaluated by a case manager, they can't get those services. So what will happen? I have no doubt that we will have more people who are admitted to hospitals, into our emergency rooms, into nursing homes, and who will become homeless out on our streets because they are not receiving this very important service. So not only are these cuts inhumane, but they're very short-sighted because that will cost us much more in the long term, both in the personal terms for that person, but also in those dollars and cents for the city. And there are already about 800 seniors who are on wait lists for case management services. That's before these cuts go into place. So we understand where we are financially, and we understand that there are very difficult decisions that we have to make. But this, to me, is not the right approach. There are alternative cuts that the City Council has called for. Just one, for example, would be to tackle the Sanitation's enforcement program, which has increased its cost by 30% in the last 3 years, but has not brought an equivalent increase in revenue. So eliminating that from the budget would save us $5 million, much more than we need to save this program. So we are here to say, as these signs say, do not cut the frail elderly. We are here to speak for them and to tell you that they may not be here in person, but they are people, and they have a voice.
Thank you. I want to introduce Councilman Peter Koo from Queens and a member of the Aging Committee.
Thank you. Hi, my name is Peter Koo. I'm from Queens, Council District 20. My colleagues and I recognize that we must protect our seniors and the programs. They need to have productive and healthy lives. Our seniors deserve to enjoy their golden years. Yet it's getting harder and harder every year with the rising inflation and exorbitant health cost increases and other quality of life issues that make seniors' lives very stressful and very hard for them. So during economic downturns, there should never be any discussions about closing senior centers, cutting the case management programs. Instead, we should look to cut ineffective and wasteful programs so that our seniors have the service that they deserve. I understand that the best way that I can honor our seniors and their lifetime accomplishments and achievements is that we pledge to support and continue all the important programs and services our senior citizens need and deserve. There will be tough economic times ahead, but we shouldn't make financial decisions that will affect adversely our seniors' programs. Thank you.
We have Councilman Mark Weapon, who actually represents the district of Linda Least, so we have a partnership.
Thank you. Thank you, Bobby. Ladies and gentlemen, I'm delighted to join with the Council of Senior Centers and Services, with Linda Least and so many of the advocates for seniors throughout this city. This is a matter of human decency. You're talking about people who could be any one of us someday, who are homebound, who are frail elderly, who did nothing wrong except get older and maybe get sick or have a problem, and we all would want that for ourselves, for our parents, for our families, if they were in that situation. So this seems like an incredibly cruel cut. And as was mentioned so eloquently by Councilmember Lappin, they can't speak for themselves, these people. They're not going to be able to get down to City Hall and get out and be heard. So it's up to us to be their voice and to speak on their behalf. And also, as Councilmember Lappin said, if we don't have these services, so many of these people are going to end up in a much worse situation without someone being able to check in on them and provide services at home. And then they're going to end up in the much more expensive nursing homes, which we have no room for anyway, or in hospitals. And they're all going to cost us all money. So even if you want to talk about the cold money aspect of this, it's not even cost effective. So I'm happy to be here today to join with these people to realize that we do understand these are tough economic times, but that's no time to turn our back on people and to be heartless and realize that this is a terribly cruel cut. Thank you very much.
I'm joined by Councilwoman Melissa Mark Viverito, who's also a member of the Aging Committee.
It's always great to stand with CSCS, all the advocates, all the providers that are providing wonderful services to the most frail and elderly in our communities. And this is quite impressive to gather this many signatures. I don't have to belabor the point. I think it's been said how cruel this is in terms of a cut. An agency that really is at most bare bones, that really cannot suffer any more cuts. That's the Department for the Aging, of which almost 20% of its budget comes out of supplements from this city council. We need to prioritize services to the elderly in this city. We need to really ensure that that message that is being promoted nationally by this administration about how age-friendly New York City is in fact the reality. And that is not the case when you see cuts just like this. So during these times, which are difficult, let's not be a Grinch. Let's try to be humane and be really considerate of those that have given so much to make this city what it is. So I want to thank all of you for coming together. You definitely have strong allies in the council under the leadership of Jessica Lappin, our speaker, and we will stand by side by side on behalf of the elderly in the city of New York.
Okay, thank you.
Oh, Jimmy Vaca.
Councilman Vaca is in the house.
He's wearing a Christmassy tie, too.
Well, you can
Wow, real Christmassy time.
come to the podium, sir.
She didn't want the Grinch, so she got you.
Councilman James Vaca from the Bronx, also a member of the Committee on Aging.
My concern is that if we keep eating away at funding for the Department for the Aging, we could be facing a day very soon where there is no Department for Aging left. That will be a very sad day for New Yorkers. I'm committed to that day never occurring because everyone acknowledges the reality that people are living longer. And as we live longer, we need to understand that this city has to be an age-friendly city. And by being an age-friendly city, we have to start somewhere, and I think that we have to start with case management. Case management cannot be abandoned. It will be case management today, it will be senior centers tomorrow, it will be other supportive services right down the line. We have to draw the line somewhere. We have a budget crisis, but are we going to cut below the bone to the marrow when our elderly are affected? And I'm here to say no. I think in the past we've worked very well together. We defeated many a harebrained scheme, and this one too is for the garbage heap. And I thank all the seniors for coming out in this cold, cold weather. But your presence today means that there should be victory tomorrow. This has to be prioritized. That goes without saying, and I support all of you 100%. I'm getting there very fast myself, so I know, not that fast. That was meant as a joke, by the way. But I'm getting as fast as all of us. And I thank you for your hard work, but press ahead in the days ahead. Thank you very much.
Questions?
No? Okay, thank you.
And if you wanted to interview, okay. Thank you all for covering this, and thank you all for coming. And we're going to deliver these letters, so you might want to watch us. Why did you watch us deliver the letters to the mayor?
I don't have this straight.